If you've had 9 out of 10 butt pain for over 5 months, like our friend John here, and it's just not going away by itself, it might be because you have this little secret problem called adhesion that almost no doctors or therapists are talking about. So enjoy this treatment visit with John.
So John,
Yes.
last time we were here, you said you were 80% better.
Mm-hmm.
How are you doing today? Same, better, or worse?
Better this week. A lot better.
Percentage overall.
I think I'm up close to 95, maybe. The only time I do feel pain is like when I try to, because I'm still shifted this way. So when I push it this way, like now it doesn't hurt. It hurt last week, but this week it doesn't hurt. But I would feel that pain there.
Walking with good posture, 0 to 10.
I got like maybe 1.
And where would you feel that? In the right glute?
Yeah.
The upper glute?
Yeah.
How intense is it when you do that?
Like a 2.
Tightness? Or like a sharp?
Yeah, like a little bit of a sharp, like, it's like the same feeling I used to have, but very less. Yeah, it's like a baby feeling.
Crunch your belly up for me, please. Crunch up. Good. What do you feel when you do this?
Nothing.
No stretching or pulling, right?
Mm-hmm.
Okay. Good job. What do you feel here?
Just stretching.
Where is it? Where is it?
Right here.
How intense? 0 to 10?
Mm-hmm. Like a 2. Nothing crazy. Just like stretching.
2 out of 10 here,
Mm-hmm.
or 70 degrees increase when I do this?
Yeah, it definitely increases.
In that same spot?
Mm-hmm.
Right here.
Mm-hmm.
What do you feel here?
Just a stretch.
Back of the thigh?
Mm-hmm.
Or
Back
the
of the
knee?
thigh. Yeah, look right here, the back of the thigh.
0 to 10.
2, 3. Stretch.
Increase?
A little bit. Yeah, definitely.
Good job.
Oh
How
man,
you doing? How you doing?
you're doing better?
Yes, very much
So happy.
Very much better.
So happy. We haven't done your left side nerve at all. So, and based on that sitting test, it sounds like it's time.
Oh yeah.
So let's have you lie, slide down the table this way, a little bit more, and then just tip over and lie on your side. So the sciatic nerve right at that spot, most people don't realize it's probably as thick as my pinky. And so you can push it. And so I'm just pushing it and seeing where it's stuck. And right here, there's a piece of bubble gum that's going against the nerve and it's resisting. It's pushing back into my thumb. So I'm gonna stick my thumb in here in case he's gonna stretch his hamstring and sciatic nerve past my thumb so I can tear the glue off, the adhesion. Go ahead. Another name for sciatic nerve entrapment here is deep gluteal syndrome. That's what you can search on YouTube to see surgery on this spot. Good. I recommend you do that because there are some really cool surgeries where you'll see surgeons using a scalpel and just cutting the adhesions or glue between the sciatic nerve and the external rotators. So glute max is the ceiling where it's close to your skin, your butt cheek. Then there's the sciatic nerve, and then underneath the sciatic nerve is the external rotator. So it's a little sciatic nerve sandwich. So look that up on YouTube, deep gluteal syndrome. We're gonna do, so his hamstring muscles come down like this, and I should be able to separate and get in between them. And this is just not as soft and supple as I want it. So the radial shockwave is a good spot for that, and that's what we're gonna do first. Nerves can be entrapped anywhere along its course. So if the sciatic nerve starts in his pelvis and goes all the way to his feet and toes, and then changes its name as it's branching out, that means that in theory, if you really want to make somebody adhesion free, you need to check the nerve at every single spot. So I checked at his butt cheek, now I'm checking at his posterior thigh, and I'm checking the hamstrings that are close to the skin, and then I'm gonna check the adductor magnus that's underneath the sciatic nerve that's deep from the skin. I found enough adhesion there for this visit, but in theory, in the future, I'm gonna check the tibial and peroneal nerves in the calf and the shin, and the plantar nerves in the foot, so on and so forth, to make sure that the nerves are completely adhesion free. Is he contracting?
Yeah, he is.
By doing an isometric contraction, we're developing tension in the hamstring so that the radial shock wave can cut through where it feels the tension like a knife to break the adhesions. What I'm feeling for is as the radial shock waves break, plowing through the adhesion, I should be able to sink my finger, which is right next to the head of the instrument, deeper. And that's how I know that it's breaking the adhesion. If it's not sinking deeper, then I need to get in there with my hands. So it's clearing out, which is what we want. Step 5 of adhesion release methods is feeling for real-time adhesion reduction, no matter which tool you're using. And you noticed I'm using my finger, my left index finger, right next to the wand of the radial shockwave to see if the adhesion is actually melting and creating more space so I could sink my finger down into the tissue. Now I can just move this tissue a lot easier, and I can get to the sciatic nerve, which is underneath here, and then push the hamstring muscles off of the hamstring, or the sciatic nerve, excuse me. Because I should be able to grab each hamstring and move it off. And right here, that's probably the worst spot. It's really pushing back against my thumb when I go that way. So we want to fix this. Good keys. What I'm noticing is I've been doing this more often in the past few weeks or few months. I'm trying to really grab and get underneath the deepest layer of the meat of the hamstring muscle, because I imagine that it's that deepest portion that's right on interfacing with the sciatic nerve, that's right next to it, right here, is the part that I'm trying to peel off the sciatic nerve, and when you could get the best feel. If I'm trying to grab the top half of the hamstring muscle and pull, it's going to be difficult for me to tell if the lower part is actually adhesed and stuck. So being very specific with your layer of depth before you tug a muscle and bow it to see if it's stuck is going to be really important to being effective. Before 4 years ago or so, we used to tell people we don't have any treatment for discs. But since we found that radial shockwave kills senescent or aging cells inside of discs to create space so that stem cells can come proliferate in that area, we will typically be able to treat joints because we have the radial shockwave machine. For this, we're going to use the radial shockwave for his disc. Case is going to be pulling his sciatic nerve, and I'm going to be treating the disc where the nerve roots go through, and we're going to see if his range of motion improves as I'm blasting it with the shockwave. Because the radial shockwave removes adhesion, and it also promotes stem cell growth and kills senescent or aging cells inside of the disc. 275 L4S1 discs. Did we give you the longevity package for him?
No.
Okay.
So you say we'll be doing this.
Melissa out front, she'll talk to you about longevity.
Okay.
The idea with the longevity visits is that I see you as little as I possibly need to see you, without you leaving for 2 years and then coming back in with an inflamed disc again. People ask us all the time, when you treat the adhesions and remove it, are they gone forever? Kind of. If you remove the adhesions, they're gone. But if you overload your tissue again, your body will lay down more adhesion in order to protect itself. So most people need longevity treatments, and in our clinic, Barefoot Rehab, they're generally cheaper than the initial case fee visits are, and it's just some way that we can incentivize people to allow us to take care of them long term. That's why we do the longevity treatments. If you want to see this full treatment video, click the link here.